This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1. Questions 1 to 12. You will hear a conversation between a doctor and a patient called Mr. Thompson. For questions 1 to 12, fill in the blanks in the notes with a word or brief phrase. You now have 30 seconds to review the notes.
Good morning, Mr. Thompson. How are you today?
Good morning. I'm doing okay, but my back pain has been getting worse lately.
I'm sorry to hear that. Chronic pain can be frustrating, but we'll work together to find a solution. When did you first notice the discomfort?
I've had some discomfort on and off for the past year, but in the last few months it has worsened, especially in the mornings.
I see. Can you describe exactly where the pain is and what it feels like?
It's mostly in my lower back, right above my hips. It feels like a deep aching pain, and sometimes there's a sharp pain when I bend forward.
Is the pain constant, or does it come and go?
It's always there, but certain movements make it worse, like standing for long periods or getting up after sitting.
Do you experience any numbness, tingling, or weakness in your legs?
No, but I do feel stiff in the mornings.
How has this affected your daily activities?
I used to go for evening walks, but now even a short walk makes my back ache. Also, I struggle to sit at my desk for long hours at work.
That must be challenging. What do you do for work?
I'm an accountant, so I spend most of my day sitting.
Prolonged sitting can sometimes contribute to back pain. Do you take breaks to stretch or move around?
I try, but when I get busy, I forget.
Have you tried anything to relieve the pain, such as medication, physical therapy, or home remedies?
I've been using over-the-counter painkillers and heating pads. They help a little, but the pain always comes back.
Any past injuries or conditions related to your back?
No serious injuries, but I did strain my back lifting something heavy about a year ago.
That's useful to know. Do you have any other medical conditions like diabetes or high blood pressure?
No, I'm generally healthy.
Good to hear. And what about your lifestyle? Do you exercise regularly?
Not much anymore because of the pains.
Understood. And do you smoke or drink alcohol?
No, I don't smoke. I drink occasionally, maybe once or twice a month.
Thanks for sharing all this information. Based on what you've described, it sounds like you have chronic mechanical lower back pain, likely due to muscle strain, poor posture, and prolonged sitting. The strain from last year may also be a contributing factor.
That makes sense. What's the best way to treat it?
We'll focus on pain relief and long-term recovery. First, I'll prescribe a mild anti-inflammatory medication to help with discomfort. However, medication alone won't fix the root cause, so we need to work on posture correction, stretching, and strengthening exercises.
Okay, I can try that. What kind of exercises do you recommend?
A physiotherapist can guide you through a personalized exercise plan, but in general, gentle stretching, core strengthening, and posture training are very effective. I'll refer you to a physical therapist.
Will I need any scans or tests?
For now, I don't think an X-ray or MRI is necessary since there are no signs of nerve damage or a serious condition. However, if your pain doesn't improve in a few weeks or worsens, we may consider imaging tests.
Got it. How long will it take to feel better?
With consistent treatment, most people notice improvement within 4 to 6 weeks. The key is regular stretching, movement, and good posture habits.
That sounds manageable.
Great. I'll set up the referral for physical therapy and write a prescription for the anti-inflammatory medication. Also, Try to take breaks from sitting every 30 to 40 minutes, even if it's just standing up for a minute or stretching.
I'll do that. Thank you.
You're welcome. Let's schedule a follow-up in 3 weeks to check your progress. If the pain worsens before then, don't hesitate to reach out. Take care.
Thank you. I appreciate it.
Extract 2. Questions 13 to 24. You will hear a conversation between Ms. Emily Carter, who consults a doctor about frequent headache. For questions 13 to 24, fill in the blanks in the notes using a word or short phrase. You now have 30 seconds to review the notes.
Good morning, Miss Carter. How are you today?
Good morning. I've been dealing with frequent headaches lately, and they're starting to interfere with my work.
I'm sorry to hear that. Let's go through some details to understand your symptoms better. When did these headaches first start?
I've had mild headaches for about a year, but they've gotten worse over the past 6 months. Now, I get them 2 to 3 times a week.
It sounds challenging. Can you describe the pain? Where do you feel it and how does it feel?
It's usually on the right side of my head, around my temple. The pain is throbbing and can be quite intense.
Do you experience any other symptoms when you have a headache?
Yes, I feel nauseous, and bright lights or loud sounds make it worse.
How long do the headaches last?
They usually last for several hours, sometimes the whole day.
Have you noticed any specific triggers?
I think stress is a big one. Also, if I skip coffee in the morning, I seem to get a headache. Lack of sleep and bright lights also seem to make them worse.
It makes sense. Do the headaches affect your daily life?
Yes, I struggle to concentrate at work. Sometimes I have to leave early or take breaks because the pain is too much.
That must be frustrating. Have you tried any treatments?
Just over-the-counter painkillers. They help a little, but the headaches keep coming back.
Do you have any vision problems, numbness, or weakness in your limbs?
No, none of that.
Do you have any chronic conditions like diabetes or high blood pressure?
No, I'm generally healthy.
Good to hear. And what about your lifestyle? Do you smoke or drink alcohol?
I don't smoke, but I drink socially maybe once or twice a month.
What about caffeine intake?
I drink 2 to 3 cups of coffee daily, but sometimes I miss a day and I notice that I get a headache.
That could be a contributing factor. Based on what you've described, it sounds like you're experiencing migraines without aura, possibly triggered by stress, caffeine withdrawal, and irregular sleep.
Oh, it makes sense. What can I do to manage them?
We'll take a multi-step approach. First, I'll prescribe you a triptan medication to take when you feel a migraine coming on. It can help stop the headache from getting worse, but medication alone isn't enough, so we need to address the triggers.
Okay. What changes should I make?
There are a few key adjustments that will help. First, try to maintain a regular sleep schedule, even on weekends, to avoid sudden disruptions in your rest patterns. Second, if you work long hours on a screen, take regular breaks to reduce strain. Stress management techniques such as deep breathing, meditation, or exercise can also be helpful in reducing migraine frequency. Instead of skipping coffee on some days, try to maintain a moderate but consistent caffeine intake to avoid withdrawal headaches. Finally, make sure to stay hydrated and keep track of any foods that might trigger your migraines.
Sounds doable. How long before I see improvement?
If you stick to the plan, you should start noticing fewer and less intense headaches within a few weeks.
That's great to hear. Do I need any tests or scans?
Not at this stage. Your symptoms don't suggest anything serious, but if they worsen or don't improve in a month, I may refer you to a neurologist for further evaluation.
Got it. When should I follow up with you?
Let's schedule a follow-up in 4 weeks to see how you're responding to treatment. If you notice any unusual symptoms before then, let me know.
Okay, thank you for your help.
You're welcome. I hope you start feeling better soon.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear.
Before we discharge any patient, we must ensure they fully understand their medication schedule. This includes knowing exactly when to take each drug, the correct dosage, and whether it should be taken with food or on an empty stomach. Patients should also be informed about any potential side effects they might experience and what to do if they notice anything unusual. If they're unsure about any part of their medication routine, we should encourage them to ask questions before leaving the hospital. While completing the discharge paperwork is an essential part of the process, our primary concern should be making sure patients have a clear understanding of their prescriptions. Misunderstandings about medications are one of the leading reasons patients end up being readmitted to the hospital. Many people forget instructions, mix up dosages, or stop taking their medication too soon because they don't fully grasp its importance. That's why clear communication at discharge is so critical. It helps prevent complications and reduces the likelihood of readmission.
I appreciate the effort you've been putting into Mr. Daniel's care and the progress he has made under your guidance. It's clear that he is improving, which is great to see. However, I still have some concerns about his recovery process. He's very eager to return to work, which is understandable, but I worry that his enthusiasm might lead him to overexert himself too soon. If he pushes his body beyond what it's ready for, he risks undoing all the progress he has made so far and could end up back at square one. To prevent any setbacks, I'd like you to remind him about the importance of pacing himself and sticking to the recommended rehabilitation plan. It's essential that he follows the prescribed exercises carefully, without skipping steps or rushing through them. Could you reinforce this message during your next session with him? Emphasizing patience and gradual progress will help ensure he heals properly and avoids any unnecessary complications.
I want to inform everyone that, starting next Monday, we will be introducing a new system for shift handovers. Currently, handwritten notes are being used, which can sometimes lead to miscommunication, inconsistencies, or missing critical details. To address these issues, we are transitioning to a standardized electronic template that will help ensure that all necessary information is recorded accurately and consistently. This change is aimed at reducing errors, improving communication between shifts, and making it easier for staff to access and review important details. The electronic format will provide a structured approach, ensuring that key updates about patient care, tasks, and other responsibilities are clearly documented and easily referenced. Before your next shift, please take some time to review the new handover guidelines so that you are familiar with the process. If you have any questions or concerns, feel free to reach out to me. Your feedback is important, and we want to make this transition as smooth as possible for everyone.
When you are dressing a wound, infection control should always be your top priority. Proper wound care is essential to preventing complications and ensuring the patient heals properly. As you clean and dress the wound, be sure to carefully observe for any signs of infection, such as redness, swelling, warmth, increased pain, or any unusual discharge like pus. These are strong indicators that an infection may be developing, and if you notice anything concerning, it is crucial to report it immediately so appropriate action can be taken. Additionally, always follow proper hygiene protocols, wear gloves, Use a sterile dressing and ensure that all equipment and materials are clean before making contact with the wound. Any lapse in infection control can introduce bacteria and increase the risk of complications. It's also important to perform regular checks on the wound, even after dressing it, to monitor its healing progress. Early detection of any irregularities can help prevent infections from worsening and reduce the chances of further medical intervention. By following these best practices, we can help promote faster recovery and ensure patient safety.
This medication is intended to help relieve your symptoms, but it's important to be aware of potential side effects, particularly drowsiness. Some people may feel slightly sleepy or lightheaded after taking it, which can affect concentration and coordination. Because of this, I strongly recommend that you avoid driving, operating heavy machinery, or doing anything that requires full alertness until you know how your body reacts to the medication. If you notice excessive dizziness, extreme drowsiness, or feel generally unwell, it's important to contact your doctor as soon as possible. These could be signs that the medication is affecting you more strongly than expected, or that an adjustment may be needed. Additionally, if you take other medications or consume alcohol, be cautious, as these can sometimes increase drowsiness or interact with the drug in unexpected ways. If you have any concerns or experience any unusual symptoms, don't hesitate to reach out to your healthcare provider for guidance.
Honestly, when we first received the emergency call, I prepared myself for a potentially critical situation. The initial report mentioned severe chest pain, which is always a red flag for something serious, like a heart attack or cardiac arrest. In those cases, every second counts, and we have to act fast to stabilize the patient. However, upon arrival and after assessing the patient, it became clear that the symptoms were actually due to anxiety-related hyperventilation rather than a cardiac emergency. While hyperventilation can still be distressing, causing dizziness, shortness of breath, and even chest tightness, it's not immediately life-threatening like a heart attack. That said, it's still important to treat the patient carefully, help them regulate their breathing, and ensure they're not experiencing an underlying issue that needs further medical attention.
Extract 1. Questions 31 to 36. You hear an interview with a neurologist. You now have 90 seconds to review questions 31 to 36.
Dr. Patel, thank you for joining us today. Many people suffer from migraines, but their exact course seems unclear. Can you shed some light on this?
Of course, migraines are quite complex and don't stem from a single cause. Instead, they are triggered by a combination of genetic, environmental, and lifestyle factors. For some individuals, stress plays a major role, while for others, certain foods or even changes in their weather can contribute. Each person's triggers can be different, which makes understanding migraines a bit challenging.
That's interesting. And the symptoms? Do they vary among patients?
Absolutely. While the most common symptom is an intense headache, many patients report experiencing warning signs even before the pain begins. A well-known example is visual disturbances, often referred to as aura, where individuals might see flashing lights, zigzag patterns, or even temporary blind spots. Others may develop nausea, dizziness, or an increased sensitivity to light and sound, making even normal activities difficult to manage during an episode.
That sounds challenging. Is it difficult to diagnose migraines?
Yes, diagnosing migraines can be tricky because there is no single test that can confirm them. Instead, we rely on a detailed patient history and symptom patterns to make a diagnosis. This can sometimes lead to misdiagnosis, as migraines can mimic other medical conditions such as tension headaches or sinus issues. That's why a thorough evaluation is essential.
Once diagnosed, how can patients manage their migraines?
One of the most effective ways to manage migraines is to identify and avoid personal triggers. Since these triggers vary from person to person, I often recommend that patients keep a headache diary. By tracking when migraines occur, what they ate, how much sleep they got, or whether they were under stress, they can recognize patterns and take steps to minimize their risk. Lifestyle adjustments, such as maintaining a consistent sleep schedule and managing stress, can make a big difference. If you are the one that has to endure with your patients, I think you could do more than recognize.
What about treatment? Are medications helpful?
Yes, medications can be highly beneficial, but they must be used correctly. Some drugs are designed to provide relief once a migraine starts, while others are taken regularly to prevent migraines from occurring in the first place. However, frequent use of painkillers, especially over-the-counter medications, can sometimes lead to a condition called rebound headaches, where migraines become more frequent. That's why it's crucial to follow medical advice and use medications as prescribed.
Finally, what advice would you give to people who suffer from frequent migraines?
My advice would be to seek medical attention if migraines are interfering with daily life. There are many effective treatment options available, from lifestyle changes to prescription medications, and a healthcare professional can help create a personalized plan. Migraines can be debilitating, but with the right approach, they can be managed effectively.
Extract 2. Questions 37 to 42. You hear part of a lecture by Dr. Collins, a surgeon, about post-surgery recovery. You now have 90 seconds to read questions 37 to 42.
One of the biggest issues I see with post-surgery patients is that they don't always follow recovery guidelines properly. Whether it's neglecting movement, skipping medications, or missing follow-up appointments, these missteps can lead to complications or slow down the healing process. Recovery is just as important as the surgery itself, and careful adherence to medical advice can make a significant difference.
That makes sense. In your experience, what's the most important thing a patient should do after surgery to ensure a smooth recovery?
Movement is absolutely crucial. There's a common misconception that after surgery, patients should stay in bed and completely rest for several days. While rest is necessary, complete immobility can actually do more harm than good. Gentle movement, like taking short walks or even just shifting positions regularly, promotes blood circulation and helps prevent complications such as blood clots and muscle stiffness. It also reduces the risk of lung infections, which can occur if a patient remains too sedentary for too long.
That's interesting. I imagine that diet also plays a role in recovery. What should patients focus on when it comes to their nutrition?
Absolutely. Nutrition is a key component of healing. Staying well hydrated is critical because dehydration can lead to constipation, which is a very common problem after surgery, especially for patients taking opioid pain medication. A fiber-rich diet, including fruits, vegetables, and whole grains, can help with digestion and prevent discomfort. Additionally, protein intake is vital for tissue repair, so lean meats, eggs, dairy, or plant-based protein sources should be included in meals. Patients should also monitor their intake of processed and sugary foods, as these can contribute to inflammation and slow healing.
That's really helpful. Speaking of pain medication, I've heard that some patients are hesitant to take it. Why do you think that is?
That's a great question. Many patients are concerned about the potential for addiction, especially with opioid medications. While this is a valid concern, when taken as prescribed and under medical supervision, pain medication is generally safe and plays an important role in the recovery process. Some patients try to avoid painkillers altogether, but this can be counterproductive. Uncontrolled pain can lead to stress, poor sleep, and difficulty moving around, all of which can slow down healing. The key is to use pain medication appropriately, tapering off as the pain decreases rather than stopping suddenly. For those who prefer to minimize medication, alternative pain management strategies such as physical therapy, ice or heat application, and relaxation techniques can be incorporated.
That makes a lot of sense. Now, what about follow-up appointments? Are they always necessary even if the patient feels fine?
Yes, follow-up appointments are extremely important. Many patients assume that if they're feeling well and don't have any obvious problems, they can skip these visits. However, follow-ups allow doctors to check for hidden complications that may not present noticeable symptoms early on. Issues like infections, delayed wound healing, or internal concerns might only be detected during an examination. Additionally, follow-ups give patients an opportunity to ask questions about their recovery and get reassurance that they're healing as expected. It's always better to catch potential problems early rather than waiting until symptoms become severe.
That's great advice. Before we wrap up, what would be your best piece of advice for someone recovering from surgery?
My best advice would be not to rush the healing process. Every patient recovers at their own pace, and trying to push yourself too hard, too soon, can actually set you back. It's important to listen to your body. If you're feeling fatigued or experiencing pain, take that as a sign to slow down. At the same time, small, consistent efforts in movement, proper nutrition, and medication management will contribute to a smoother recovery. And of course, always follow your doctor's advice and reach out if anything feels off. A well-managed recovery can make all the difference in ensuring long-term health and well-being.